Did you know that the way you breathe can impact your muscle and joint health? Poor breathing has been associated with neck pain, neck stiffness, core stability issues, lower back pain, and more. So before we get into what constitutes poor breathing, let's talk about what normal breathing looks like. So normal breathing is a seemingly effortless process that involves inspiratory, or breathing in, expansion of the rib cage and the abdomen, and then expiratory, breathing out, contraction of the rib cage and the abdomen. One of the main muscles of respiration, one of the main muscles that helps us breathe, is the respiratory diaphragm. This is a dome-shaped muscle that sits right under the rib cage, and how it functions is as the diaphragm contracts, it lowers and allows the lungs to expand within our chest. This creates a vacuum drawing air in. Once the diaphragm relaxes, it raises back up, air leaves the lungs, and we exhale. Now, since the diaphragm forms this barrier between the thoracic rib cage and the abdomen, once the diaphragm contracts and lowers, with nowhere else to go, the contents of the abdomen just slightly push out against the abdominal wall. So if you watch someone who's breathing properly, they're actually going to expand the belly and the sides of the abdomen. This is where we get the term belly breathing. So if that's what belly breathing is, what's the opposite of that? Or what's the thing that we're talking about that constitutes poor breathing? That is if someone is a chest dominant breather. Now, what is chest breathing? So unless you're exercising, the diaphragm and the intercostal muscles, these little muscles in between the ribs, should be the main muscles that are helping us draw air into our lungs and exhale air out of our lungs. Unfortunately, due to poor movement habits and postural habits over time, we can overuse these muscles that we call accessory muscles of respiration. These are your upper trapezius muscles, your scalene muscles, these muscles around the neck. These muscles are okay to use in respiration when we are exerting ourselves, when you're exercising, when you really need to draw air into your lungs. But when you're just relaxing during the day, these muscles should not be the main muscles that we're using for respiration, although most of us tend to use these muscles over time. That is what can drive some of the neck pain and neck stiffness that we get with poor breathing habits. So what can happen with excessive chest breathing or chest breathing that goes untreated? When we chest breathe too much, we're going to be taking shallow, short breaths. We're not going to be using the full extent of our lungs, so you're not going to be getting as much oxygen to your tissues as you would like. Some of the symptoms of excessive chest breathing include tightness or sore muscles in the neck or upper back, frequently waking up at night, poor posture in the shoulders and upper back, shortness of breath, sleepiness that does not get better with additional sleep, diminished or poor exercise performance, or excessive sighing or yawning. Those are both attempts for your body to try to get more oxygen into the system. At this point, you might be asking yourself, am I a chest breather or am I a belly breather? So we're gonna do a simple drill to figure that out. I'm gonna have you lay on a comfortable surface on your back with your knees bent and your feet flat. You're gonna put one hand on your chest and one hand on your belly, and you're just gonna take some halfway deep breaths in and out. And I want you to notice which hand is raising up and down more. Is it the hand on your chest or is it the hand on your belly? Sometimes what we'll see is we'll see a paradoxical breathing pattern, which is definitely a sign that someone is a chest breather. A paradoxical breathing pattern is one where when you inhale, the hand on the chest raises up, but the hand on the belly sinks in. So that's sucking your belly in. Sometimes your hand on the belly doesn't move at all, but the hand on the chest raises up and down. What we want to see is the hand on the belly lifting up and down with each inhale and exhale, and maybe a little bit of movement in the chest as well. So if you found that you're a chest breather and you want to learn how to breathe properly, we're gonna stay in that same position and work on a few things to help cue proper breathing. So start off by laying on your back, that same position, with one hand on your chest, one hand on your belly. Focus on taking nice deep breaths in through your nose and out through your mouth. As you breathe in, I want you to think about your stomach pushing up against that hand, okay? Think about lifting that hand that's on your stomach, okay? Expanding your stomach. And I want you to just have minimal movement of the chest as you're breathing in and out. Now, as you exhale, I want you to focus on exhaling any tension away. Let the shoulders drop. Again, as you inhale, think about expanding the belly, lifting that hand that's on your belly. Try not to let the shoulders raise up as you're inhaling, okay? Keep them down. And then as you exhale, let the stomach fall. Now, we don't simply want a forward and back motion of the stomach as we're breathing. As we talked about before, the diaphragm is this dome-shaped muscle and it surrounds 360 degrees under your rib cage. So we want to make sure that we're getting side-to-side expansion as well as forward to back expansion. So same position as you're on your back. I want you to take your hands now, like crab claws, and you're gonna put them around your belly. As you inhale, your hands should do this. As you exhale, they should do this, okay? Same thing, we wanna keep minimal movement in our chest and shoulders and most of the movement in the stomach as you inhale and exhale. Another great position that we can use is one that we call alligator breathing. This is when you're laying on your stomach, okay, and you're focusing on your breath. The benefit of this position is you have that tactile sensation of the floor or the bed against your stomach. So you can feel as you inhale, your body lift up slightly. As you exhale, it lower. We can also practice breathing in a seated position as well. This is how you should be breathing during all day-to-day activities. When you're exercising, we might be able to let this slide a little bit. That's a different conversation for another day. But during your normal daily life, this is how you should be breathing. So do little checks. When you're sitting at the red light, take your crab claws, put them on either side of your stomach. When you're working through emails, do the same thing. Make this a habit. So how do we address breathing issues in our office? Now, most people don't come in complaining of breathing issues. They come in complaining of neck pain, shoulder pain, lower back pain, and then we find that one of the root causes of their issue could be the way that they're breathing. So we'll take them through a similar process that we just did here today, but in a lot more detail and in a lot more individualized way. We also have a great piece of technology called the Core 360 belt that allows us to visually see, using a graph on the iPad, how well someone is expanding or breathing into their belly. There's no guesswork. We can check their breathing in the laying down position like we did here, or we can even move them into a more athletic position like squatting to make sure they're breathing appropriately when they're exercising. If there's any joint tightness, muscle tightness, we'll address that with the modalities that we have at our disposal. In general, we create a personalized plan for the individual in front of us. So if you are concerned with the way that you're breathing or the way that you feel, please feel free to give us a call or visit us online at TruMotionTherapy.com.